Delirium is a brain condition common in ICU patients that affects the way a patient thinks. Nearly half of the patients in the ICU suffer from delirium during their ICU stay. Delirium may be hard to detect, but you, the family caregiver, may be the first to notice small changes in thinking in your loved one. There are ways that you can help to prevent and manage delirium. Your help may stop delirium from happening, reduce how long the delirium lasts, or how severe the delirium is. This short video will tell you about the signs of delirium, who is at risk, and what you can do to prevent and manage delirium. You can use the information from this video not only in the ICU, but throughout your loved one's hospital stay. Here are some signs of delirium you should look for. A person with delirium cannot pay attention. This person is easily distracted or, when you speak with them, cannot focus on the conversation. May have trouble thinking clearly. If you ask this person a question, they may reply with an answer that does not make sense. They may also not know where they are, forget who you are, or do not understand what is going on around them. Have sudden changes in mood and behavior. This person acts differently than they did before they were admitted to the ICU. Have changes in sleep, such as staying awake when they should be asleep or sleeping when they should be awake. They may see or hear things that are not there. These things they see or hear feel very real to them. A person with delirium may be agitated or upset, or drowsy or quiet. It is important to know what may cause delirium. These include stress, dehydration, medical illness, infection, surgery, a change in location, such as admission to a hospital or transfer to another unit, medications. Some medications that help a person's medical condition may also cause delirium. Malnutrition, pain or fever. It is also important to know who is at increased risk for delirium. These include people who are older, people who have dementia, people who are mechanically ventilated, which means they require machines to help them to breathe. Delirium sounds a lot like dementia, but there are a number of key differences. Delirium develops suddenly. Changes happen over hours, days, or weeks. Dementia develops slowly. Changes happen over months or years. Delirium usually improves or can come and go. However, dementia does not improve and gets worse over time. Delirium can be caused by illness or medication. Dementia is rarely caused by illness or medication. Now that you know about delirium and signs of delirium, what can you do to prevent or manage delirium while your loved one is in the ICU or hospital? Bring in photos and items from home. Put these items where they can easily be seen by your loved one. Make sure your loved one has their hearing aids and glasses. Help with a normal sleep pattern. During the day, keep the lights on and speak with your loved one. At night, turn the lights off and keep it quiet. To help with sleep, provide sleep aids such as earplugs or maybe a blanket from home. Orient your loved one. This can be done a few ways. Speak in a calm, reassuring tone of voice and tell them where they are and why. Do not overdo this, as sometimes this might cause your loved one to become frustrated or agitated. Other ways to orient your loved one include reading the daily news out loud on a subject that is interesting to them, and talking about a favorite vacation or meal that you both enjoyed. If your loved one is mechanically ventilated, they are unable to speak, but they can understand you. Communication can be difficult, so try what works best for your loved one. This may include only asking yes or no questions, or, if your loved one can write, providing them with a pen and paper. Other ways to prevent and manage delirium are play quiet, calm music that they enjoy, use items in the cognitive box to keep their mind active, Spread out visitors throughout the day. If you see signs of delirium in your loved one, tell a member of the ICU care team. For example, you can say, "Yesterday, my family member was easy to have a conversation with. Today, they are not paying attention. When I ask them questions, their answers do not make sense. They are also sleeping more than usual. I think they may have delirium." Or, "I notice my family member suddenly is confused. They were not confused this morning. Are there any changes to the medication that might be causing this?" Do you think you can identify signs of delirium? Read the descriptions of made-up ICU patients given to you by the research team. Complete a SOUR 7 questionnaire for each made-up ICU patient to detect whether the patient has delirium or does not have delirium. This practice will prepare you to identify signs of delirium in your loved one.